Welcome to the Future of Human Performance, a conversation with leading experts on how to physically train and cognitively prepare for high-pressure situations. I'm Alan May, host and analyst with Monumental Sports Network. Today's conversation brings together perspectives from elite sports, military training, and leading-edge technology to explore how human performance is evolving. By exploring how elite athletes and elite military forces train, recover, and prepare to be at their peak performance, we can better understand what drives readiness and resilience. Joining me here today is a panel of training and medical experts.
Tyler Christiansen, I'm a strength and conditioning coach with GDIT as a human performance advisor.
Hi, I'm Dr. Aubrey Grant. I'm a clinical sports cardiologist. I direct our sports cardiology program at MedStar Health. I'm also a team physician with the Washington Capitals and the Washington Wizards.
Dr. Alexander Kheradi, sports medicine physician with MedStar Health, also a team physician with the Washington Capitals, and former United States Air Force major.
To kick us off, Tyler, how do you describe human performance and how and where is it applied?
Yeah, I actually wrote a white paper about this, defining human performance for the Department of War. In it, we talk about the ability to effectively respond to physiological, psychological, and not only that, but their technical and tactical skills of whatever their occupational specificity is. In that, it's looking at, now that definition, people tend to think it's just the physical aspect. Well, it's not more than that. It's the aspect of that you have an AT, an athletic trainer, a physical therapist, occupational therapist. You got the psychological, cognitive component, diet, spiritual, and then also the sports med team. So that's one of the things, and it's the human performance is really kind of captured in the aspect of capturing all the information in a holistic manner. And that working at GDIT, that's what we do, is we capture the holistic information using technology and being in the forefront to capture all that information and then clear up the white noise that may be existing within that information.
All right, and so Dr. Grant and Dr. Kheradi, how do you see the practice of human performance influencing readiness, and how do you treat professional athletes? I'll go with you first.
You know, honestly, the field of sports cardiology and sport performance is really one of the nascent subspecialties within cardiology. I mean, we're just beginning to understand, the bounds of what super physiologic training actually does to the heart. And you'd be surprised, athletes' hearts actually look very different than the general population's heart. And so in this understanding, we've been able to apply, different modalities of traditional cardiovascular testing to be able to help these athletes, help these tacticians to be able to perform at that peak level that they're hoping to do in their careers.
And Dr. Kheradi, the same question to you.
Yeah, I think what we've seen is kind of a shift from more reactive medicine to more proactive medicine. Something in particular that I've seen is kind of a shift from kind of this standard historically when somebody would have a musculoskeletal injury, tendon injury, cartilage damage, either in season, out of season, we would kind of go towards really kind of quick treatment options, such as like corticosteroids. Now what we're seeing is kind of a shift to more proactive and restorative and regenerative procedures. So these are where I'm sure you've heard about PRP, so platelet-rich plasma, prolotherapies, bone marrow aspirate concentrate, tenotomies, and the list goes on and on. What we find is that we're actually now looking at more tissue healing than just take care of the symptoms. And I think from a long-term perspective, that's going to allow for better durability and readiness.
In the practice of human performance, we see many sports trainers who have worked with both professional athletic teams and within military. Talk to us about what some of those training protocols are. How are they similar between how athletes and military forces train?
Yeah, in my time I've worked on the professional sport, collegiate sport, and then also the tactical. There's a lot of overlap in that area. From a strength and conditioning aspect, we'd like to look into what's called Yonda's upper lower cross syndrome. It's the aspect of lengthening the front side and strengthening the back side, and that's kind of a general rule of thumb. When I was working with a baseball organization, when I was working with them, I found that they sat a lot. So it would take time to basically lengthen and strengthen. So I think when I got to the special operations community, I thought that we could I would not have to look at that again because they're kicking indoors, they're doing this, they're doing that, when in all actuality they're sitting in the team rooms, they're sitting. So there's a lot of correlation between that, and then the aspect the human body's the human body, and so if I tear my ACL in the NFL, if I tear it in special forces, that recovery protocol is going to be pretty similar.
And the same question to you, Dr. Grant.
Yeah, one overlap that I see quite frequently in my practice is that, whether you're a military personnel or you're a professional athlete, intensity matters. And on a physiologic level, what we see when people are operating at that level of intensity, your stress hormones are going crazy. Your norepinephrine levels are high, your cortisol levels are high, your epinephrine, all these things are surging through your body in certain concentrations that, the normal person might not experience on a day-to-day. And these hormonal changes can have real robust changes on your cardiac physiology and your cardiac performance. And so, my practice of medicine is being able to help athletes, being able to help military personnel, being able to operate within these bounds of intensity.
And Dr. Kheradi, how do you find all these as well?
So I think one of the biggest things to keep in mind is cumulative fatigue. So when these either military operators or professional athletes are going at it day in, day out, whether that's, being on the road as a NHL hockey player or, operational tempo as a military operator, you really need to take into consideration what is kind of their max fatigue threshold. Yeah. And with that is going to come then you need to then intercede and start thinking about recovery. Okay, so recovery really needs to be part of training, and I think that's a huge aspect.
That's a really good point. One of the big things that I see in my practice of sports cardiology is this concept of autonomic dysfunction. And so my point about intensity matters. And so when military personnel or professional athletes are operating and their sympathetic systems are chronically going or stimulated, it can cause people to have this sort of baseline level fatigue. And so your point about how do we recharge, how do we repair our bodies is so critical.
Yeah.
And Dr. Grant, from a medical perspective, what do you look for to assess how someone is performing at their peak with prolonged stress?
One thing that I'm really fortunate to have within my armamentarium as a diagnostic clinician is, a suite of cardiac testing. So we have ultrasound, we have cardiopulmonary exercise testing. We're able to document VO2, which can be really helpful to guide how people train. We also have certain wearable devices that people can use to help understand their HRV, their heart rate variability. And all of this is sort of to help us create a clear picture about where that person is operating on the peak level of performance.
And Dr. Kheradi, how do you assess injury risk from a whole body perspective?
Yeah, so I think kind of going back to that idea of fatigue, with increasing fatigue is going to come kind of cognitive depreciation as well as musculoskeletal depreciation, and there's a direct relationship there. And so I think something, for instance, that you could be, attuned to, especially in the locker room, is things like, is somebody more irritable? Okay, are they having difficulty with focus, concentration, reaction time? Are they complaining more about musculoskeletal soreness? Is there a lingering injury that constantly keeps coming up because they're compensating for certain things? Is there an imbalance there? So I think that's really the importance here, is just being in tune to, are these athletes or operators, are they too overworked? Okay, and do they need that time for recovery, like we talked about?
One point you mentioned, and I'll just specifically talk about this detail, is ACL injury. ACL is a tear injury is a big thing that we see in sports, and oftentimes once you've had that injury, the likelihood of this happening again can sometimes be elevated. And so what we're researching and trying to understand at MedStar Health is there some interplay between the orthopedic side of things and the cardiac ability to actually operate at that physiologic level. And so we're doing VO2 max testing to see if these athletes and these military personnel are ready from a cardiac perspective to return from that ACL injury.
And for both of you, once again, how might that come through in the injuries that you're treating?
Yeah, so, I think, I would go back to an analogy, like, how are you doing at the end of a run, right? If you're running, 2, 3, 4 miles and you start getting fatigued, you start getting lazy, okay? You start losing form. You might see more overuse injuries start to manifest, and I think that's the type of thing that we need to look into. And so is it these repetitive tendinopathies or musculoskeletal injuries because we're not giving people time?
One thing I will say too is, we are taking care of high-level athletes and high-level military personnel. And so one thing I always try to express to my patients and my tacticians is trust your body. You know when things feel right. You know when you're feeling at the peak level of performance. And if things don't feel right, maybe come seek guidance from a Dr. Kheradi or, myself to really sort of understand how to get back to that level of performance.
Great conversation. Let's continue with a local star on the ice.
Sandin on the go, enters the zone, gets the middle, tap, tap, passing, snapshot, score! Pierre-Luc Dubois.
I am with Capitals star forward Pierre-Luc Dubois. Thanks for being here, man.
Thanks for having me.
Okay, you're coming back to playing after an injury this season. How have you partnered with your trainers with a personalized regimen to get you ready?
Yeah, so I think, first we have athletic trainers who are more on the medical side. We have the strength and conditioning who are more, your personal trainer performance. And then we have our team physicians. So those three and me at the beginning of a long rehab process sit down, make plans for a weekly plan and then monthly and then, at the end goal of coming back. Throughout that whole process, at the beginning, I'm just laying on my couch for a week, 2 weeks, 3 weeks. It can be hard, but I think that what they did a good job of was really setting short-term goals, walking, getting back in the gym, because the whole process of rehab was, it's rehab at first, then it's conditioning in the gym with a strength coach, then it became skating by myself, really getting back on the ice, and then it finished with team practices and eventually into playing. So the whole process can look daunting at times. 3.5 months of not playing, not being out there with your teammates is hard. You go from playing and then 2 weeks later on your couch. But I think the mental side of it, of them keeping it fresh, like I said, keeping short-term goals, weekly goals, really helps throughout the whole process of feeling like you're a part of a team and not just an individual rehabbing.
All right. How do you and your fellow teammates on the Caps work with trainers to condition and train both in and off season?
Yeah, it's another important aspect of our careers. I think the team does a really good job, but that's more strength and conditioning. He does a really good job of talking to our strength coaches back home, because a lot of guys go back to where they're from in the off season to train, but it's important to be all on the same page. So the player, team strength coach, and your strength coach back home, you look at some examples. We do off-ice testing every training camp and halfway throughout the season to see kind of where every guy is individually, and guys coming back from surgery or rehab, how they're doing in the whole process, before coming back to play. Are they back to where they were before? But to be on the same page going into the off-season, heading back home, some guys have to work more on explosiveness, some guys have to work more on upper body. But with the testing and the communication between everybody, I think it allows for a seamless process and coming back to training camp feeling good.
How has your prehab training evolved over your career, and are you applying any of those principles to your recovery now?
Yeah, every guy's different. Early on in my career, I'd play soccer before the game and then hop on the ice. And then as your career evolves, so does your body. And, you need a little bit more. But, I've played with some guys, Trevor Van Riemsdyk, Sergei Bobrovsky, every day, every practice, every game. They have this set routine where it never changes. And, they have times on the clock where they got to be doing this exercise and so on. And then you got guys like me early in my career where it was the complete opposite. But, I think I see it as two things. You're preparing your body physically, but you're also preparing your mind mentally. And the mind is just as important. So the prehab stuff, whether it's before practice or before a game, just checking boxes to know that, okay, once the game starts or once practice starts, I checked all these boxes and I'm ready to go both physically and mentally.
So you face high pressure, high stakes games. What have you leaned on mentally to stay resilient and keep pushing forward?
Yeah, I like to look at it as, I make my practices hard so that the games seem easy. And, if I do the same reps over and over again with the same concentration level, with the same attention to detail, then I know that whether it's Game 7 of the Stanley Cup Finals or Game 1 of preseason, yes, it's a different environment. Technically it's more stressful and technically it's bigger stakes. But if I pay attention to the details in Game 1, then I'm ready for the Game 7 Stanley Cup Finals. So, I think every goal that you set is a long-term process, whether even if it's a week or a year. but the details that you take care of early on really let you achieve those goals at the end of the season.
Okay, last question. What are you looking most forward to next season?
Yeah, I mean, I think I definitely took it for granted, but just being healthy. I've been lucky throughout my career, throughout my whole life, really. I've never really been injured. My setbacks were always, you get injured on Monday and you're playing next Sunday. So this season, to really go through that whole process of, you're watching your teammates, go out there every night, battle every night, and you're just watching and there's nothing you can do, was really hard. But I'm just looking forward to being healthy again, being on the ice, being with everybody, being part of the team throughout the whole season again. But I'm extremely grateful for all the staff that helped me throughout this whole process this year. And, I learned a lot. So I don't think any year goes to waste, even if, you spend three months of those up in the stands watching down.
Pierre, great answers and great interview. Thanks for being here.
Thank you.
Let's continue with our panel. When the stakes are high, how is this impacting an athlete or an operator's performance?
Yeah, when the stakes are high, it's not about at that moment. They always say you rise to your level of training, you don't rise to the moment. With that said, so in that training process, it needs to be thought of little snake bites, prepare you for the large dose of venom. So it's taking those steps on the front side to prepare for what's going to happen. Now, you have non-contact injuries, you have these other little things, but then they can still be thrown back into the process. It's just that process starts with the med team. And when they get cleared, they go from them to the physical therapist, to the athletic trainer, to the strength coach, and we just start that process over again.
And for the doctors, how can they be ready for these events and perform at their peak when there's so much on the line? Dr. Kheradi.
Yeah, so something we do with that MedStar Health provides for the Washington Capitals is we do what are called pre-participation physicals, okay? So this is something we do at the beginning of the year. We also do them for our rookies, and it really allows us to assess them and get a good baseline at the beginning of the season, really before the season even begins, in order to kind of, again, proactively jump into any issues that we could get ahead of. So things that we're gonna do are laboratory evaluations, musculoskeletal exams, neurocognitive testing, going back to the mental health component and the neurocognitive function of our athletes, ophthalmologic examinations. All this is going to give us a good baseline, so if we have any deviation through the season, then we can go back to that, and that can give us some answers on how to treat.
A part of that pre-participation evaluation screening that we're doing with the professional athletes, we're also doing sort of a comprehensive cardiovascular screen as well. So we're doing complete physical exams, we're doing EKGs to really sort of understand each athlete's unique cardiovascular signature, so that when they are faced with these high performance situations, these high stress environments, we feel confident that they can operate at their peak performance.
And Dr. Grant, how do athletic trainers and medical teams identify cognitive fatigue overload? What does it look like, and how do you treat it?
For me, I think part of this goes back to relationships. And so, as Dr. Kheradi mentioned, we're meeting these guys very early on, certainly in their careers, but certainly in the season. And so we have relationships. We know when an athlete feels off or when they're not sort of achieving at their peak level of performance. And so, we're constantly interviewing them, engaging with them and sort of understanding what their performance is. And so if we see that they're not operating at that level that we expect or we sort of understand them to be, that is a clear signal that maybe there needs to be an in-depth medical evaluation.
And Dr. Kheradi, what are some of the injuries, the conditions that you treat, and is there a way to prevent these through human performance technology? What low-cost, high-impact interventions that make the biggest difference to keep someone active in a game or a mission?
Yeah, so I think something that, both the military as well as the NHL and the Capitals have started to take very seriously over the past few decades is concussion. So one of the things that we're kind of changing the paradigm shift for is concussion recovery. And so, gone are the days where we'd stick you in a dark room and say, come out 2 weeks. Okay, now we've kind of adjusted our treatment profile to more active recovery. We've gone back to that theme here. So one of probably the cheapest ways that we can intervene is through moderate aerobic activity. So if you get somebody a pair of running shoes or a stationary bike, you can get them on a good road back to recovery by getting their heart rate up, getting them into the zone 2 level, where there's a lot of data saying that that's going to cut down on recovery time. In addition to the moderate aerobic interventions that we can do, which that's probably about as cheap as you can get, there are actually some really good supplements out there that don't cost a whole lot. So we're really, we're looking into things like magnesium, coenzyme Q10, alpha lipoic acid, creatine is making a big comeback, melatonin for sleep. All these are great adjuncts that we can use in the setting of concussion recovery and are definitely low-cost interventions.
And Tyler, what are some of the ways, after listening to the doctors, that you keep the players active?
Yeah, post-injury or even, when they're in a time of a lot of travel and things like that. One, simple biomarkers of, things you can wear around your wrist, things like that. Also, tracking, talking about zone 2, excellent way to, especially post-injury, to help eliminate some of that waste product that may still be in the bloodstream. So those are a couple different ways that are low cost and high value for getting people back up and moving.
And Dr. Grant, which new technologies are shaping the future of training, injury prevention, and long-term health?
The fortunate thing I will say is a lot of the things that we utilize are not necessarily new. We're just utilizing them in a different way, in this sort of super physiologic capacity dealing with high-level athletes. And so one thing that I think is really impactful is the utilization of VO2 testing, VO2 max testing. And so we utilize that test in particular to actually define what each person's idiosyncratic zone 2 is. And so we're able to create heart rate zones that athlete or tactical person can operate in to be able to ensure that they're getting the maximum amount of cardiorespiratory fitness from that exercise.
And Dr. Kheradi, it's basically same question to you.
Yeah, so something that I feel that has really intercalated itself within both sideline medicine as well as military operations is portable ultrasound, okay? I use ultrasound day to day in my clinic. It's a much larger machine, but what I use in the locker room, or even what I've used previously on the back of a C-17 is a portable handheld ultrasound. And this has been incredibly helpful in diagnosing certain issues like, say, Achilles tendon rupture, patellar tendon rupture, knee effusion, pneumothorax, okay, or even bleeding in the abdomen, all right? And so this has been a really critical component that we've started to use both in the locker room, sideline, as well as in military operations. Now, another thing that we do really well at MedStar Health is also access to MRI, okay, so magnetic resonance imaging. This, we can get for our players either same day or next day. And the key here is that the quicker we make that diagnosis, the quicker we're going to get them to recovery, okay? And determine whether or not they're safe to return that night or if we have to start going down a different pathway to treatment.
And Tyler, after listening to the doctors, anything you can add to this?
Yeah, no, the return to duty is one of the biggest things that military tracks, or the return to play model, right? I think that's one of the biggest things we can do. And then on top of that, like I mentioned before, is gather all the information, clear out the white noise, and find the specific picture that you're looking to go after.
And Dr. Grant, so what's next? The last takeaways, what are the most important principles from professional sports that the military can realistically adopt to improve readiness?
One thing that I think about is, I certainly enjoy meeting athletes, military personnel in that moment of impact, in that moment of competition. But, I would be remiss if I didn't think about these individuals across their whole lifespan. And so operating at this level of intensity for, training for peak performance can cause some cardiovascular implications. And so being able to understand what is a sort of long-term risk of these activities, on that person's lifespan. So ensuring that we're checking for coronary artery disease, we're checking for simple things like high blood pressure, we're checking for cholesterol, just to ensure that although, yes, you are this peak level machine, we're making sure we're getting the simple things right too.
And Dr. Kheradi, last question, any takeaways? The same question basically.
Yeah, so having worked both active duty and with military operators as well as with professional athletes, I think we really need to go back to this whole idea of being proactive in our treatment, okay, and not being reactive. Thinking about what's not best for tonight and getting that athlete, or what's not best for getting that military operator back on the back of that C-17 so they're ready for that deployment, and what can we do for them in the long term. If you guys have time, I'll give you an example. So when I was active duty, I was getting ready for a deployment, and I had just injured my hip and I had a pretty large labral tear. I wasn't going to be able to go on my deployment because of the tear, but I was needed to, okay? They needed me there. And so what I did was I went and I accessed one of my active duty sports medicine colleagues. He gave me a PRP injection in my hip. I was able to complete my deployment. I was able to come back safe, and I'm still reaping the benefits from that PRP injection today, 7 years later. So, you know, I think when we approach things less as a just let's get it done and treat the symptoms and more of a long-term approach, you can see the results here. Okay.
And Tyler, do you have any last takeaways?
Yeah, I think it's about the holistic approach. There tends to be things done in silos across the board, both in DoD and probably in the sports community. And it's about breaking down those silos and then making an integrated, holistic picture from point of impact of injury, or even on the pre-screening side, all the way to the performance of when they're on the floor or in the field. The future is technology, and we need to make sure that we are going with the times, utilizing technology, and that's what GDIT does. It's a leader in integrated tech, and it utilizes AI to kind of clean up a lot of that information that we're capturing from the tech field. And so it's getting that common operating environment to bring in the data, clean up the message, so that you have maybe start to move towards that predictive model versus a reactive model.
And gentlemen, excellent conversation. Thank you very much for being here today.